Good morning.
Hello.
All right. We got the doc back.
Thanks for having me back.
He doesn't have a choice at this point.
Yeah, I realized I got roped into this
You're welcome.
somehow. So now I'm a co-host.
You're welcome.
Welcome to my podcast.
I was gonna say, welcome to his podcast. I'm just here to look cute and read questions.
Yeah. We're gonna have you answer some questions about nursing one day. I think that would be cool.
Uh,
Can't just be me doing it.
sure, it can. Sure, it can.
Well, we'll figure that out. Don't worry, folks.
God help us all. Leave me answering questions. They will not be serious answers.
Yes, they will. Wait, let's give a background before we go into the questions.
Background. Yes.
So last time we did a whole Q&A on women's hormones. Thought that was awesome. I think it got pretty good feedback.
Yes. Yes.
And then part of the hormone series, we don't want to leave the men because they're always underrepresented, right?
And the women aren't. And the women aren't. Okay.
Cue sarcasm. But yeah, so we want to make sure we also address men's hormone because that's also been popular for a while. Men have always had it a little bit easier in terms of obtaining hormone replacement for medical reasons and non-medical reasons. So we're going to talk about some questions that some of the viewers have about it.
Yeah. All right. You ready?
Let's do it.
How do I know if I need testosterone replacement therapy?
Great question. Give myself a second to think. Really, there's no good way of knowing. As I've kind of pointed out in a few episodes, a lot of symptoms of low testosterone can be explained by a lot of other symptoms. Typical things we see with low testosterone, fatigue, developing more belly fat, the rate at which your muscles increases, the rate of loss decreases. You could have just overall not feeling good, brain fog, your libido goes down, not necessarily your inability to get an erection as a male, but just the drive for it. A lot of that can be explained by poor nutrition,
Yeah.
can be explained by lack of sleep, by stress, by so many other things, by certain chronic diseases, depression, anxiety, high blood pressure, diabetes. So many other factors play a role, which keeps me employed because I have to figure that out. Around 30, 35, men's testosterone really starts to decline. Probably even a little bit before that, but really around that age is when you're starting to see a higher rate of decline in men's testosterone levels. And in my experience, usually around 40 to 45 is when men start questioning it and really ask about it because it's probably gotten down to a low enough level for people to start potentially feeling those low testosterone numbers. Because a lot of times, in your 20s, 30s, you're at pretty high levels, 800, 900. Every man is different. And that's another thing I think that's important to point out early on. So for one guy, quote unquote, low normal level of 400 will be fine. He is jacked. He's at the gym, high libido, doing what he needs to do. And that's good. And he's feeling great. So that's his normal. There are other men that's going to be low and they feel better at 500, 600. I'm making this up. Generally, there is a threshold, kind of like that statistical bell curve, that under a certain amount, most men are going to feel poorly. We're talking under 300, really under 250, where most guys are really going to be having an issue. But like I said, every body is unique. So at different numbers, you're going to feel different things. So that's important when we talk about testing and interpreting the results. So that's your science spiel.
Science test.
So did that even answer that question?
Yes.
How do I know?
Yes.
Yeah. So those are
It varies.
Those are the symptoms. They need to be correlated to a low testosterone. And if all that lines up and other things are discussed and ruled out, maybe that is your testosterone level. That's the problem.
Okay. So then I guess to jump with this one, why are docs so quick to jump to HRT without any further diagnosis and getting that initial low result?
Yeah, so that was an interesting question.
I'm
I
telling you,
don't.
man, I spent a good chunk of time talking to this person, and it was actually the wife, not the husband.
Fair,
I
fair.
was like, "Huh."
Yeah, the reason that's interesting is traditionally most docs are not quick to jump. Most docs don't want to provide testosterone. In medical school and early training in a lot of fields, primary care is the one I could speak to. That's my specialty. We're kind of taught that giving men testosterone is bad. It's really for the bodybuilders who are doing it to look good and get jacked, the steroid users. Um, and in the past, we used to have a really big fear on testosterone's effects on prostate health and heart health. So that's why that question is interesting. 'Cause for at least for my growing up in medicine, it was really don't give testosterone. Don't do it. Most men are asking for it for performance reasons, not true,
Not true.
medical. They don't really need it. It's performance based. So that's been my experience of the tradition of how a
Okay.
lot of docs do it. So that's why that question's interesting. So I'll
Yeah.
answer maybe both. Why are some afraid, which I kind of already mentioned. Some docs might be jumping to it. I can't speak for everyone. Maybe it's now popular. Maybe it's easy. Maybe they don't have the time to dive into looking at other things.
That was the only thing I could think of. It was like the
Yeah,
time. They just, I mean, they don't.
yeah, yeah. And we talked about that for a lot of providers, especially in primary care and other specialties, just don't
Yeah.
have the time. They're trying to go. Other patients are getting mad and waiting. But both extremes aren't good. You don't want to just jump
Right into it.
to a medication. Everything has benefits, everything has harms. We have to be aware of it. We shouldn't be afraid of certain medications. Everything has a place, it's a tool, and we shouldn't just jump the gun either. So there's a happy medium, but it takes time. And
Yeah.
that might be
That's probably the
that's the
problem.
problem.
They don't have the time.
Yeah, and who knows? Maybe this one person just had a bad experience, and that happens.
Yeah.
Doctors are humans too, almost. I mean, we're kind of godlike.
Jesus, Mary and Joseph. Yeah.
No, but we are humans. Things happen. Yeah.
All right. Well, I guess we kind of touched a little bit on this. What other factors other than age can affect low testosterone?
Yeah. So age is just a kind of general decline. Men don't go through the same kind of menopause the way women do. So we call low testosterone andropause. But it's not that a man's testicles completely stop producing it the way women's ovaries just stop producing estrogen at a certain point.
Men
Not
always
quite
have
the
it
same.
easy.
Yeah.
You always have it easy. It's
No.
fine. Whatever.
Hate us because you ain't us.
I mean, you
But
know what? Next
no,
question.
but
I'm
yeah,
kidding.
it's that is the truth. It doesn't always completely stop. There are some men, there are conditions where the testicles will just stop producing. So,
Yeah,
but for most men that we're kind of talking about, it just starts to decline. So it doesn't fully stop. Remind me of the question again.
what other factors other than
What are
age,
the factors? Yeah.
which we kind of touched
So
base on?
there's a few things. So there's certain things that will actually directly affect your testosterone. Certain medications, obesity will affect. So a little more science. Um, Fat cells have a thing called aromatase, and aromatase is what converts testosterone to estrogen. Now, men have estrogen too. We need estrogen,
Right.
same way women have testosterone. Just different levels, different response rates, whatever. And a certain degree of estrogen is necessary. But when when men are obese, there's more levels of estrogen that are
That makes sense.
produced. That causes a feedback loop sometimes, or can lower further lower testosterone, and it has effects on libido, energy, kind of your typical low T symptoms can occur from obesity. Certain medications will mess with that. Depression medications can, but
Yeah.
again, some people need to be under depression medication, and not every medication will cause that
Yeah.
for everyone. And then chronic disease will do it long term. Lack of sleep will cause symptoms similar to this. I mean, imagine you're going on days with really crappy sleep. You're not going to have energy. You don't
Yeah.
have energy, you're not gonna have a libido, you're not gonna have the same endurance in the gym. Your body needs rest, and if you're not giving it the rest to recover, muscles are gonna suffer from that. Your brain's gonna suffer from that. Everything's gonna suffer.
Yeah.
Same with poor nutrition. You're not getting enough vitamins, minerals, you're not getting enough protein, you're not getting enough calories in general to fuel your body.
Feeling attacked again.
you're you're going to suffer. So that could be other causes of low T. Hormones are made from fat, to oversimplify it. So if you're not getting enough healthy fats, long term that could affect it. So it gets complicated, but that's I'll leave it at that for the answer.
Okay, thanks.
You're welcome.
Leave it short, sweet, and to the point.
Yep.
Appreciate it.
Let's keep it practical.
That's fair. Let's see here. What test do I need before starting?
Great question. If you're if you've ruled, let's say, assuming we've ruled out other problems, your thyroid's fine, nutrition's fine, diabetes fine. If we're just kind of talking, I'm about to start testosterone. I know, my symptoms are linked to testosterone. We're comfortable with that. Obviously, you're going to want to see your testosterone levels. So for men, I would want to see the total testosterone. You could make an argument in a lot of cases to see the bioavailable testosterone. So what does that even mean?
I was gonna say,
What does that mean? So most hormones that are circulating through your body have to be attached to proteins to be circulated, or they're just broken down too fast by the body's natural processes. So when we talk total testosterone, we're talking about the total testosterone attached to those proteins and the free, which has detached from that vehicle that's transporting it and is actually acting on the receptors. And most of the time, your total testosterone's high, your free testosterone's high, and it's easily correlated, and you could just go based off the total. There are some conditions where the total appears high, but the free is really low because those proteins are not letting go of the
okay.
testosterone, or there's just too much of those proteins binding up all the circulating testosterone that's not letting it cause the effects it needs to cause. So without overcomplicating it, having those two levels is important. I'd want to see a blood count, and we could talk about that when we talk about side effects, but I want to see a CBC.
Yeah.
Seeing a lipid profile might be important too, if that hasn't been done. I want to see cholesterol. I want to see a PSA, and we'll get into that, the history of testosterone and prostate, but I want to see a baseline PSA.
Yeah.
If it's been done in the last 3 to 6 months, I'd probably be okay with that number and don't have to repeat it just for funsies. And sometimes prolactin. So, prolactin is another hormone coming from your brain. That's part of this feedback loop of hormones in our bodies, especially when we're talking about sex hormones like testosterone. So, I want to check on the prolactin just to get a baseline, make sure that's not affecting anything, and sometimes to monitor it down the line. So I think that covered the one specifically related to testosterone hormone, assuming everything else has been looked at.
Looked at and fine.
Mhm.
Okay. Will it help me build muscle or lose fat?
It can. It can if you use it. So if I'm taking a guy and they're truly low on testosterone, their symptoms are legit, and I just give them testosterone, and they continue to sit on the couch and do nothing, the chance of them building muscle by itself is very low. Very
It's
low.
not magic?
It's not magic.
Damn.
Not magic. Their metabolism will potentially go up a little bit. Their basic metabolic rate is what I mean.
Yeah.
Uh, they will maybe get a little bit leaner off their baseline, and maybe the rate of their muscle decline or loss of muscle will go down because the testosterone is helping stop that effect or adding to that effect. But they're not going to just get jacked
Just by sitting on the couch.
and just doing shots of testosterone.
Dang
Yeah.
it.
You want to use it. And when you're going to the gym, you're eating well, yeah, then that process really gets improved. Again, if you're using physiological testosterone at a healthy level, you're not going to look like those crazy bodybuilders that compete, but you'll feel
Thank
stronger.
God.
Your endurance will be better. Your recovery will be better. You can push out a little bit more reps potentially, es especially if you were low to begin with and it was truly related to
Well,
that. So if you
yeah,
started at a deficit, true problem, we're getting you back to normal, yeah, you're gonna
you're gonna
feel
see
that
that.
boost.
Yeah.
Yeah.
Um, will HRT affect my fertility?
It can. So let's talk about the different ways of, and why.
This is all new to me. I do
So,
emergency medicine, so I'm just like, I got
yeah.
nothing on these.
Hey, for some of these guys, it is an emergency. So when we talk about testosterone replacement therapy, right, we're talking about testosterone. Um, Hormones generally have a feedback loop,
Mhm.
right? Hormones are messenger molecules. We talk about testosterone, it kind of starts in our brain. There's uh, hormones that are released that then circulate, get to our man's testicles, and that stimulates those testicles to produce testosterone. And there's a feedback loop. Too much, too little, things get shut down or turned back on in a healthy person. Oversimplification, a few other hormones are involved, but essentially it's this feedback loop keeping things balanced. If you're now starting testosterone from the outside, it's going to shut down the natural process. Your body's like, I have testosterone, a lot of it. I'm going to shut down the process here. The hormones that affect the testicles are going to decrease. And those hormones not just increase your testosterone, but they increase sperm production or stimulate sperm production. So the use of testosterone will decline sperm counts or shut it down when used long enough or at high enough doses. So, men, this is not birth control.
I was
This is
gonna
not
say,
a
I was like,
guarantee. This is not male birth control. I repeat, but it definitely can affect fertility.
okay.
So, and I always have that conversation with the guy that's coming in. Oftentimes, when the guys are in their mid 40s to 50s, they're like, I'm done having kids. I don't care.
Yeah.
Um,
So they meet that 26-year-old. Just kidding.
but I have that conversation with them. There are other ways of doing it. So there's medications called enclomiphene and Clomid, which people in the world of infertility
That's why
will
I
be
was like,
familiar with. Yeah. So for women, that medication stimulates those hormones in the brain, and those hormones for women increase ovulation.
yeah.
In men, they could increase sperm production and testosterone production.
Huh.
So why aren't we just using that? Because it's not always super effective. There are non-responders,
Yeah.
and it's hard to titrate and adjust the dose. But if I have youngish guy, let's say in his 30s, and he's having true testosterone deficiency symptoms, and we find out, this really might be from low testosterone levels, and he tells you, but I'm trying to have kids. I want another kid. We're not sure if we're done having kids, whatever the reason. You could do clomiphene instead and try to boost their testosterone levels. But it's hard to always know how high they're going to go, how well they're going to
Yeah.
respond versus testosterone injections. You could keep going up, up, up until you find their good dose. Um, so that can help with fertility. And there's another injection, HCG.
Yeah.
That can be done with testosterone to try to support sperm production, pretty much prevent it from shutting down. Can be also done, but again, if you're using testosterone, there's still that risk of it affecting your fertility. So make sure you speak with your doctor, make sure it's unsafe. Don't just go to a random turnkey place where you give them money and they give you testosterone without having a discussion with you about your values, what you're looking for, your specific issues. Yeah.
So find somebody who will listen to you,
And someone who listens to you and has the time to do it.
like a concierge
Like a
doc.
concierge doctor. You're right. Funny, funny. Selfless
Wow.
plugs. Thank you.
You're welcome. Here for you. Let's see here. Is it safe and what are the risks?
Yeah. There's no such thing as medicine or supplement without potential side effects. Testosterone has it too. For the right people, the benefit will outweigh the risks,
Yeah.
but in some people, it won't. So let's talk about potential downsides. Testosterone, if we're talking about just testosterone injections, creams, one of the things they do is they stimulate your bone marrow to produce more red blood cells. And that could actually have downstream effects where if your blood gets too much red blood cells, gets too concentrated, it could lead to clots,
Then you
strokes.
come see me.
Right. And then you end up in the ER with her and say, then it's an emergency. When done safely, you could prevent that. It definitely is dose dependent. The higher the dose you go, the more concentrated your blood can get. And that's why routine monitoring is important. So when I have guys on testosterone, even if they've been on it for a while, I'm checking them every 3 months, 4 months,
Okay.
maybe 6 months if they've been on it and their levels have always been good. I really don't let them go past that. And I have thresholds. I'm like, if your level starts to creep up above a certain number, you need to give a blood donation, which is kind of cool. It's a win-win in that.
Yeah. Not
Or if
bad.
they can't give a blood donation for some reason, we do a therapeutic phlebotomy. We just take the blood and
Blood,
have to
yeah.
trash it if they can't donate
Yeah.
blood. If they get beyond another threshold, then I stop their testosterone until it gets back down to normal, and then we have to rethink the dose we're using. And the higher you try to push your testosterone level, the more at risk you are for that. So that's one risk I monitor for sure. We talked about fertility effects. That's a risk. Then there's the old history of prostate health, right? In the past, we used to really worry that if we use testosterone, that's going to fuel prostate cancer,
Okay.
either cause prostate cancer or fuel it if you have it. Luckily, there's a trial that came out, the Traverse trial,
Mhm.
that kind of looked at that a lot more closely. And not to bore too many people trying to keep this practical, essentially, we've seen that for healthy men who really need it, and it's truly necessary, it's not going to cause your prostate cancer. It's not going to fuel a fire, especially above a certain point. Like extra testosterone is just not going to fuel any prostate cancer. You should, if you have high risk of prostate cancer, you have active prostate cancer, talk with your doctor, especially in active and metastatic. We probably will
You're
not
not
be
gonna
using
I was gonna say, I don't think they'd be using
the
that.
data is not sufficient. I think the urological societies, and forgetting the exact wording that's being used, so don't come after me. But with metastatic prostate cancer, we just don't have enough data to know, and we're not taking that risk. With others, I think we have sufficient data where it's fairly safe, but even in active non-metastatic prostate cancer, I would be very hesitant and discuss with the urologist. But otherwise, I'm not, I'm giving men testosterone and not worried about causing prostate cancer.
Oh,
I monitor their PSA, and if there's any kind of weird rate of rise, we either stop, monitor, talk with the urologist if need be. So that's kind of that. Questions on heart disease have always been the case because some testosterone therapies can increase certain cholesterol levels.
yeah.
So we've heard about that. The oral testosterones that get processed through the liver will stimulate more of that cholesterol issues. That can potentially be a thing, but the actual risk of how bad is it really isn't huge. I generally don't use oral testosterone
I was gonna
anyways.
say, I thought you said you didn't use the whole
Yeah, I don't
oral
like
stuff.
oral stuff because of the liver effects.
Yeah.
Injections, pellets, creams, I monitor cholesterol, make sure it's okay, but generally it's fine for men who are either low risk, haven't had heart attacks, don't have major cardiovascular disease. If someone's just had a heart attack or a recent stent, they're not getting it because there's some downstream blood vessel effects.
Yeah.
We don't need to dive into that. But if someone recently had a heart attack, stroke, recent stent, we're waiting. And if they've had a heart attack or some cardiovascular issue like the stent placement, and it's been a year, I'm going to weigh the risks and benefits, talk to the cardiologist, and figure that out. Because after a year, they may have more benefits than risks in the right people. All right.
All right. How do I take it? Injections, gels, pellets, oral? What are the
Yeah.
options?
So we kind of covered that. I
Yeah.
don't like to use orals just for the liver stuff. For men, the best effects are really seen from the injections, the twice a week injections and the pellets. There's pros and cons of both. Creams can work too. The benefit, they tend to be easier. You don't have to poke yourself. You don't have to go anywhere. Um, Creams tend to be cheaper to a degree, short term at least. Long term maybe depends on the economics of what your insurance is paying or not paying. But sometimes creams can get messy. Not everyone absorbs it well. But I have guys that use creams and love it.
Yeah.
Not disparaging that at all. It's good, like I said in another podcast, it's good to have a menu of options.
Yeah.
And some men are going to do better on one versus the other. But really, in my practice, creams, injections, pellets for guys.
If you are a diabetic and on insulin, please keep your testosterone and your insulin in separate areas. Do you
Yeah.
know how many patients I've had through the ER because they accidentally confused their insulin for their testosterone?
Oh, wow.
Yeah.
That's interesting. And I
And I've
now
been
add,
chasing their blood pressure or their blood sugar for
holy moly, yes.
Yeah.
Be careful. Actually, now with their GLP-1s too.
Yeah.
Yeah, be careful with the injectables. Separate them, know what you're doing. That applies to your oral medications too. Make sure
Yeah.
you take what you're supposed to be taking. But yeah,
That was
confusion happens.
yeah.
People make mistakes. People are people.
He took 100 units of insulin instead of his
100 of tests. Ooh.
Yeah. I was like,
Okay.
"Oh, man. That was a fun night."
Yeah. Yeah.
And we were boarding in the ER that night, and of course, he was my patient. It's fine.
Yeah.
Watch
Okay.
what you watch
But
what
you
you shoot
saved
up.
them because you're awesome.
Yeah, that's what it was. All right, let's see here. Will it improve my mood, focus, or sex drive?
Yeah, definitely can. If those things are affected by low testosterone and that's the cause, getting your testosterone to healthy level will help those things
Yeah.
for sure. Um, should I talk about what healthy levels are? Is there a question that's asking that? Should we wait?
Nope, there's no question on that.
All right, I will talk about healthy levels of testosterone.
Yes, please.
So there's different schools on this. Some people will say getting it a little bit above super therapeutic or super physiologic, actually is the right word, has some added benefits for longevity. So we're talking above 1,000.
Oh.
But above 1,000, you're also now risking more side effects. And maybe in some men, that is a nice sweet spot. Generally, between 600 to 800 to 1,000, I think is good for most guys, most of the time in most situations. Some people, some guys who are doing it more for, you know, bodybuilding, whatever, will try to really push those numbers. That gets risky. Like we're talking above 1,000, above 1,200. You're really risking stuff doing that for this aesthetic, for whatever other gain that's not fixing lifestyle stuff.
Yeah.
Most quality of life things will be improved for men at like the 800 level.
Okay.
Just general well-being, muscle wasting, libido, insulin levels, all that will be fine. And they're actually getting a ton of benefit. Past that, you're now just squeezing things out. And I don't think, I don't, the right choice of words, I don't think you're getting a ton more above
Yeah.
that. But
Placebo effect.
placebo, just very little. You're trying to get more and more and more and risking more side effects after that. But there are some guys who I've had above 1,000, carefully monitoring them, but they needed it. It really helped them a lot more than when they were on 600 or 800. And I had to get them there eventually. And that'll
So is that
happen.
something that you have to kind of slowly go up in?
Yeah, my general practice, go low, go slow.
Okay.
It takes patience. I rather do that. That's kind of my philosophy than just throwing something at someone at a high dose and risking side effects. By going low and slow, I'm more careful. It can be sometimes frustrating if that person will eventually need to be on higher doses because then it takes a while. It's like, why am I not getting better? Why am I not getting better? So you're risking that, but I'd rather do that than risk something bad happening.
That's fair.
Just my philosophy.
Why am I getting alerts on that? Whatever. It's like, all right. Let's see here. How long do I have to stay on it?
Yeah, great question. So potentially forever or as long as you want. Similar as in women, once your body no longer produces the, good amounts of the hormone, it's not going to
Yeah.
produce it all again. None of these medications jumpstart your natural production. And for now, who knows what we're going to come up with in the future? But testosterone replacement and clomiphene, it's replacing stuff your body no longer can produce. So you'll be on it as long as you're healthy and it's safe and no side effects for as long as you choose.
Okay.
There might come a point where maybe the benefits no longer outweigh the risks much later in life, past 70, past 80. Everyone's going to be a little different, but that's a discussion between them and their doctor.
Yeah. How soon will I see results?
Cool question. Hard to say. I always like to hedge my bets and say 4 to 6 weeks.
It's always 4 to 6 weeks.
4 to 6 weeks.
Everything's 4 to 6 weeks.
A lot of things are. I'll be real. Some men will feel things as soon as a week or two.
Okay.
Kind of like a little boost, like I'm feeling a little better, feeling like a little more like myself, less cloudy, just a little more happier. Libido starts to improve. That could happen within a week or two, but it's not the case for everyone.
Okay.
So I tell them at least 4 to 6 weeks. And that's assuming the dose we're using is the right dose.
Yeah.
Sometimes it will take a lot longer to feel the effect if your ultimate dose is much higher than what you're starting at. But that's okay. Start low, go slow.
I think that's all of them.
Cool. Any questions you have about this?
Look, so many, but
Ask a few.
like so many, but that's a different story.
Yeah, I'm trying to think what else would I want people, because these are great questions. I think it
Yeah.
covered everything I generally would talk about with my patients. And just highlighting, be careful. Don't just hang everything on low testosterone, which has become popular, more and more popular. It can be so many other things. Find a doc that's going to listen to you. Take the time. And maybe it won't be all done in one appointment. Maybe it's going to take a few appointments. That's okay. It's your body. Be careful when you put anything in it. Find a doc you trust and who's going to really walk you through this safely. Because it could be great benefit if really you need it. People love it, and it can be a game changer for lots.
Oh, wait. Now that you said that, hold on. There was one that.
I
know.
Missed one.
I'm sorry.
Always double check your nurses, guys.
Why? I double check myself. Thank you.
Don't come after me for that comment. I'm sorry.
You know what? Go ahead. Leave all the comments on that one. Do I have to see a specialist, or can my regular doctor prescribe it?
Yes. I'm the quote unquote regular doctor. I'm primary care. You do not need a specialist like a urologist or an endocrinologist to do it. But your regular doctor needs to know what they're doing.
That's the part.
And not all specialists know this thing specifically about testosterone replacement therapy.
Yeah.
So even if they're a regular doctor or specialist, ask them how comfortable are they with the topic of prescribing it. Have they prescribed it before? I mean, it's not from a physician standpoint or a medical provider, whether you're a nurse practitioner or PA. In the grand scheme of things, this is fairly straightforward and not an overly complicated thing. But as with anything we do in medicine, got to be comfortable with it and know and read about it, talk to people who've been doing it, get their opinions, and get that experience.
It's not like the ER where we're like, we'll try it.
You don't want that, because this has long term. In the ER, you're saving lives. Things need to be done right then and there.
We get very creative in that place.
Yeah.
Okay? I'm like,
appropriately so. With this, we have time.
That's fair.
I don't think it's life threatening. I was like, is there
know.
any situation where it's life threatening? Probably not.
No.
So if it's not life threatening, you have time. Take that.
Yeah.
Yeah.
Take your time. Find a doc that will actually sit and listen.
Like a concierge doc.
Like a concierge doc, because they have more than 15 minutes to see their patients.
Exactly.
Selfless plug. But All right. Anything else, doc? Any closing words?
No, those are my closing words. See your concierge doc.
See your concierge
doc. Concierge isn't for everyone. Find a doc that takes the time and cares. And be prepared. It may not be over one visit.
What? No immediate result?
You may need to take some time. And this can be done as a video visit. Maybe you recommend that. Like, there's For
Yeah,
a consultation for hormone replacement, you don't necessarily need a physical off the bat. So it could be done video, could be more convenient for everyone involved.
that's fair.
So maybe they're flexible about that.
Just make sure they get blood levels.
Yeah,
They get some.
obviously,
Look,
obviously.
there are some where I'm just like, they didn't test you for anything. They're like, no.
No, you want the testing combined with the symptoms. Because, like I said, you could have a normal testosterone, quote unquote, normal of 400.
Because it's normal for them.
It's in the normal range that we see on labs, but they're feeling true low testosterone symptoms,
That's fair.
or even at slightly higher, or they're kind of low, but they feel fine. So you're not going to give them testosterone.
No.
Yeah. So it all depends. You need the combination of the clinical symptoms and the numbers to really make a good decision.
Yeah, guys.
Those are my closing words.
All right. But yeah, if you guys have any questions, comments, concerns, keep those to yourself. No, I'm kidding. Please let us know if you
Yeah.
have any questions, especially because this is very, very much a community-based podcast, which I love.
Yeah.
I've,
I love
we've,
just answering questions. It's my job.
it's fair.
Makes it easy.
Noted. All right. Bye, guys.
Bye.